This is Take Two.
Would your therapy practice be the kind that you are not allowed exactly to show or like tell your clients what they should do, but kind of be like, here it is on a plate?
So where I come from, so the form of therapy I do is called Pluralistic Therapy. So
Pluralistic?
So it's quite an inclusive kind of, and it adds a lot of stuff into it. So some people may, if you're familiar with psychotherapy, you may have come across integrative, which is basically, or eclectic, where it's kind of taking bits of all the different therapy styles that are out there and mixing and matching, rather than being a purist in one form of therapy. So I think last count there's something like 300 or 400 different styles of therapy that exist. So so there's a lot of different therapies out there.
400?
Something like that. Yeah, it's ever growing. So what I'm saying is I come from the pluralistic side, is what I've trained in, and what that essentially is doing is allowing for, rather than there being one correct way of doing therapy, it's allowing for multiple different possibilities. And where I come from then is very much a place of, and I even say this to clients when they come in, I might not be the best therapist for you, but let's figure out if I am or not. And if I'm not, that's okay. And I'm very clear with that, because I think it's very much about getting the right fit between therapist and client and what they're looking for, and the therapist that delivers therapy in a way that makes sense for you, because it's about getting the right fit for you. So with pluralism, what I do then is I'm able to constantly check in with the client. And I even say this to clients, like, when I check in with you, it's not about getting an ego boost and you tell me I'm the best therapist ever. I know that doesn't exist, but it's more about, are we getting the right fit for you? Are we focusing on the stuff that you want to do? Are you looking for more space to just reflect and talk and think about things? Or do you want to be doing? Some people want to come in and they're like, let's get doing stuff. Give me stuff to do between sessions. I want to be on this. And some people are very much in that action kind of orientated mode and ready to deal with their issues. Whereas others come in and it's like, no, I need to figure this out. I want to understand where it's coming from. So maybe we need to go back into the past a little bit. Where does this stem from? So there's lots of different ways that I would approach it anyway as a therapist for people, and try and tailor it for what makes sense for them and the issue they're presenting and what they're hoping to gain from therapy as well.
So you kind of do have a bit of a one-size-fits-all nearly?
Well, there's limitations on that, because obviously I haven't trained in all 300,
Exactly.
So I can only offer what I can offer.
Yeah.
But it's about figuring out, well, what makes sense for you as the client and when you come in, and if that's something I'm able to offer, fantastic, let's try to do that. If it's something I can't offer, I might know somebody else who can, or I can at least tell you maybe this approach might be more suited to what you're looking for. It's not something I offer. I don't know anyone in that area, but at least you're going away with okay, I'm looking for X type of therapy.
Yeah, I get you. So you can go like, okay, listen, CBT might be the thing for you. Like now you have a Google search.
Yeah.
And it's up to you. Yeah, no, that's fair, really.
It's quite daunting trying to find a therapist, I think, because...
Oh, it's so daunting. Yeah. I don't know if I mentioned it. I mentioned it at the very, very start of my podcast. I think like episode 8 or something. I would have been going through quite a time. And this was back in Galway. And I was like, all right, fuck it. Like, I'll try therapy. Like, I was still like really soaked into educating myself in like the self-help space and all that sort of stuff. I feel like that's nearly every self-aware person's like early 20s. So I was mad into it, and I'm like, okay, let me try therapy. And I think I got to like 3 sessions in. I was like, this is not going well. So I started just talking, and he's explaining to me automatic negative thoughts. Yeah. And I was like, yeah, I know, ANTs, I know, next, like I was like one of those patients nearly. And then in the third one, he's like, oh yeah, so what about your family or something like, he asked me something. And I was like, I already mentioned this to you. And he goes, oh, I didn't write it down. So he's trying to fucking flick through. So like red flag, number fucking God knows what. Then he cut my session short because he had to move his car so that he doesn't get a parking ticket.
Okay.
I fully walked out with your man, like we walked out together and all that. And I was like, Yeah, I don't take that.
Yeah, I'm like, no disrespect, like not trying to bash on any other therapists out there,
No.
and let's not name anyone because I don't want
I
to know.
forgot his name.
Oh, good. But just from a general context, as a fellow therapist, I'd be thinking, yeah, lots of things with that I'd be not such a great thing.
Like, we were nearly arguing, you know what I
Yeah.
mean? Where I don't even know what I wanted in that moment in time. Probably someone to say that I was right.
Okay.
You know, that was probably it. And like, the way he just approached it was so fucking wrong. And I think it's difficult as well, because when it comes to therapy, that's what I've heard anyways, is you want to go in and you want to talk, but then when you like sit down and you're like, do I just start complaining?
Yeah.
Like,
What do I talk about?
Yeah, like, because it is kind of true that you do feel like the entire weight of the world is on your shoulders. But then when you go to share it with the person that actually should be hearing it and not your friends and all that kind of stuff, it's like, I'm fine. Like, it's grand though.
And I think what comes from that though is, well, one thing I want to go back to that you mentioned about the writing notes thing. Personally, I have a pet peeve with that. Like, I don't think therapists should be writing notes in the middle of the session, because to me that takes away a lot of what's going on in the therapy process. Like,
Oh my God, so true, yeah.
I mean, if you're as the client, you're talking to me and you say something that you feel is like, oh my God, I just had this eureka moment, and the therapist is not writing it down. It's like, maybe it's not that big of a deal actually, you know, or that's the reaction you have. Or you say something that just a throwaway comment, and next minute the therapist is writing. It's like, well, what was it about that I said that's so important that they're writing that down? So it pulls you out of the process.
Oh, it pulls you out so much. He was like, okay, we're like, to help with your anxiety, let's do a body scan. And I'm like, all right, noted. He's like, no, I'm going to show you how to do a body scan. I'm like, mate, I've heard this so fucking often. Your man was breathing in front of me and I was there in a room with my eyes open, just looking around. That's how fucking shit he was. But anyways.
I think though as well, like, with one thing on that though, I think that's really important, and this is where I come from with my clients, is about, it's another part of the pluralistic approach, is collaboration. So it's very much about, I might have a toolbox of stuff we can take a look at, but you are an expert in your life. I'm not an expert in your life. So you will know, or you'll have a sense of what might work for you. You just don't necessarily know what the tools are. So let's work together. And the way I say it to clients is, you're in the driving seat, I'm just the passenger with the map. And that's the way I tried to put it, because I think then at least you have control over where we go and what we do. I'm just giving you suggestions along the way. And I might give you something as like, I think it might be worthwhile that we take a look at this or do this or whatever it may be. But it's you that decides. So like that with your body scan example, if I was to come to you and say, would you be interested in taking a look at body scan? You can turn around and say, well, I actually am very familiar with that and I don't think it would be a best use of my time. Great, let's move on to the next thing.
Exactly. You actually kind of do help out with the maps a little bit. But yeah, shitty therapists are around.
They do exist.
People do, unfortunately, give up on that a few times.
Yeah.
And that is going to be like a topic that we will be discussing, is there being someone for you, or just like even recognizing that, you know, because obviously I have brought it up a few times where like mental health care is not as easily accessible in Ireland and affordable nearly as much as like which is a pity, because a lot of the charities right now do tend to aid for the people in crisis, and rightly so.
Yes.
But then it's like, where are we going with this? You know what I mean? People don't have that much money to fork out for like weekly sessions. But yeah.
And I think one thing, you're kind of hitting on a thing that I try and just, it's nearly like a mantra of mine in therapy. It's like, psychotherapy is not about when you're in crisis.
Yeah.
Or not just about that, at least. Yes, like you're pointing out, when you're in crisis, it can be a help. But at the same time, it's like, we don't wait until we have our arm hanging off before we go to the GP.
Yeah.
So why do we wait until we're in absolute crisis before we engage in therapy? Now, there may be other factors like financial access, etc. They are issues in themselves. But assuming all things equal, we still are not great as a nation, I think, of it's still very much a taboo topic, or it's becoming less taboo, but it has been a taboo topic to even acknowledge mental health issues or problems, or, you know, having struggles. So to be able to engage in the therapy process, I think, is really, really important. Even when you're in a relatively good space, to be able to just figure out some of the other stuff that you've been hanging on to for a period of time.
I've heard of people as well. There is this one person that I just thought of who has a very good approach when it comes to therapy, and it's like, if just finding your person, and then if you're going through a good time, you know, if you just see your therapist once every 4 weeks, 8 weeks, and then when things get tougher, you increase that consistency again, and then you let it go again, and it's just like, obviously you don't want that friend and patient approach, but kind of having it be that way, that it's like, okay, I know that Dr. so-and-so, like, I'll just be seeing them next month, you know, or once every 2 months. And then when things do get tough, just increase the session.
Absolutely. So the way I say it to clients is that it's not about therapy necessarily ending. It's about taking a break and stepping back from it. And that break could be 2 or 3 weeks. It could be years. It's whatever makes sense. But I always say to clients, the door is always open to come back in. It's not about going in, doing X number of sessions and therapy's done.
Don't start from scratch, exactly.
Now, if they choose to go to somebody else after a period of time, that's fine. And I encourage kind of people making sure that they have the right person for the right issue at that particular stage in their life. You know, that's another aspect to it. But yeah, my door is always open for my clients to come back if they choose to.
100%. Now, what are you studying right now? Like, what's your research?
Yeah, so I'm doing my doctoral study at the moment, and what I'm taking a look at is that intersection of people who are trans, so transgender, and ASD, so autism spectrum disorder. So there's a lot of research out there at the moment that's indicating there's actually quite a huge overlap between the two. So I might just kind of, just in case anyone's not familiar with the terminology and that, I might just do a very brief explanation of that for your listeners. So if we were talking about trans, so it's become an umbrella term as such. So historically we would have had transgender and maybe transsexuals, and there would have been differentiation between them. However, at least in Irish society anyway, and more so across the world, but we've started to use trans as the more umbrella term for that. So it's people who are born one gender, but that's not who they are. Their gender identity is different. And then if I talk about ASD, so autism spectrum disorder, that has become a umbrella term in itself as well, which is interesting. So we've two umbrella terms here going on beside each other. So again, historically, we would have had autism disorders, that there would have been multiple kind of subsections of that. So maybe Asperger's would have been one in the past before. But in 2013, that was changed from the mental health kind of perspective. They changed it, and now it's just autism spectrum disorder is what is the diagnosis that you would end up getting if you were seeking one. And there was a bit of controversy about that, the kind of amalgamating a few of them into the one kind of...
Why the controversy?
Well, there was the losing out of the distinction between some of the sub-diagnoses. So, for example, with Asperger's syndrome, that's somebody who may be perceived as not having the same level of intellectual disabilities of some people who may have autism, for example. That's one distinction that's there. So by kind of removing those sub-labels, for want of a different way of saying it, there's a kind of generalization of what it means to be autistic, when I've heard of people talk about as well, my version of autism is, and it seems to be quite important and individual to some people. So hence a little bit of controversy around that and debate around the amalgamation into an umbrella term.
Because again, from an outside point of view, I did notice that the topic of autism has like started to be on the increase. Even like there has been a little bit of research coming out about like the different diagnoses for girls, and like why do so few girls are diagnosed with autism, for instance.
Yeah, so the ratio there is 3-1. So it's 3 males get diagnosed with autism to every 1 female is the ratio that I've seen anyway. And some of the debate around why that might be is in relation to a lot of the research historically around autism would have been done with young boys. So girls weren't even included in the research to begin with.
Exactly.
The other side of it, and this is more of a personal thing, so I don't have the research to back this up, but I wonder though as well, just from a societal perspective, is boys acting out somewhat more socially acceptable in general versus girls. So girls are kind of socialized in a different way. And I wonder then, does that then translate to girls getting used to having to mask their behaviours or who they are or how they interact socially with people? And that just translates over into the autistic traits being masked for females, whereas with males it might be slightly more acceptable for them to act out in certain ways that would make people maybe wonder or question, does this child have autism, or is it something we need to check out or whatever?
So many issues like that seep into the cracks because of such things.
Yeah.
You know, my chat with Andrew McGovern, like he talks a lot about like the concept of bikini medicine and sex differences in science and research, to the point, what were we talking about? Not sure if it was menopause or breast cancer, something like audacious, where not a single woman was brought into the research for it. And this wouldn't have been too long ago.
Yeah.
So we are probably at a stage now, and you could correct me, but I feel like when I do see such movements happening and things being on the increase and people complaining about it, a lot of the times them being male saying you're shoving it down our throats. And it's like, no, what you're seeing is the pendulum start to swing and things like kind of trying to keep up now, sort of. The wheels are moving quicker.
Yeah, and there's almost that equalization within gender then as well. And, you know, for some people, if they've been privileged, and not that we're here to talk about privilege per se, but if we've been privileged, when there's an equalization, it can feel like the privileged are being oppressed as a result of that equalization, because they're not used to the level of attention other groups are maybe getting, when in reality it's an equal attention that they may be getting at that stage. So
that and equity comes into the discussion as well. But yeah, look, that kind of situation, or this speed at which things are being acknowledged and redone nearly, or an attempt to do better, is happening right before our eyes. If you were to look at it from like a positive, like with the glass half full approach, because we can look at other things that are happening,
of course,
that are just like on decline, unfortunately. So what is the connection? So I know that you explained ASD and that it's a spectrum as well.
Yeah.
Because there is quite a misconception or a stereotype nearly when people think of autism. They think of the nonverbal.
Yeah.
And is extreme correct, or?
It could be, or they have that that kind of media representation of what autism might be. So if we think of maybe certain movies and that have been out, where people like the reclusive genius kind of idea might spring to mind for some people who, when they think of somebody with autism as well. So again, like you say, there's quite a spectrum in reality.
That is not often spoken about, correct?
Yes, but the extremes, as you're kind of highlighting at either end of that spectrum, might be what people perceive the word autism to represent, or somebody with autism. So yeah, there is a spectrum within that. Similarly, I would say then as well, when we think of gender, I certainly come from a place of gender being a spectrum. That's my position on it. And I think, yes, there's a level of maleness and a level of womanness that people will have. And we fall somewhere within that. So that's where I sit with it. So again, we have two umbrella terms, we have two spectrums of sorts, and what the research is showing is that there's a high prevalence of these overlapping a lot of the time. And what I mean by that is, so if we take just a couple of statistics, don't want to bombard everyone with statistics, but just a couple. So in the general population around the world, depending on which research you look at, but it's coming out at that 1% of the population is on the autism spectrum disorder. And then when we look at transgender, it's somewhere between slightly under 1% up to 2%, again, depending on what research you look at. So that's just the general population for the two of them separately. But if we start to look at research that's more recent, as you're saying, like research starting to look at newer areas, they're starting to look at the intersection of the two. So people who may be transgender and have autism, so not just one or the other. And somebody who is trans or non-binary are 3 to 6 times more likely to also have a diagnosis of autism spectrum disorder than the rest of the general population. So it's quite a significant number. And the inverse of that is also noted in research. So somebody who is diagnosed with autism are more likely to have gender dysphoria. So that's, you know, somebody who has dysphoria, like uncomfortableness, not being able to feel themselves, etc., as a result of their gender not matching their actual physical sex. So it works both ways. It's not a one-directional thing that if you're trans, you might end up being ASD, or if you're ASD, you might end up being trans. It's more the overlap between the two seems to be there within research. And what was interesting was there's an Irish research only released last year that had a look at this. And what they found, this was spanning over 9 years. So it was quite a lengthy kind of set of information that they were looking at. But what they found was that of the trans and non-binary population in this particular study, 11% also had a diagnosis of ASD. 11. And then
kids or adults?
This was looking at youth, so probably under 18, if I remember correctly, with that particular research. But what was interesting then as well was there was another 3% of the population in the study that had autistic traits. So they didn't have a diagnosis, but they demonstrated autistic traits. Wow. So it's quite like if we go back to the first statistic of 1% of the general population having ASD, for example, from a global perspective, those numbers, while I'm not saying they're 100% accurate and we can just stay on them, like obviously it's beginning in the research area and that, but the indications are there is quite a large overlap here. And the reasons for it are still to be decided.
Yeah, exactly, because when doing research on it, like that was something that was commonly coming up, is that like we're still trying to explore the reason for this connection. Now, I don't think it's a theory, but the way it was explained in like dummy terms for someone like me to understand is the mentalization of gender identity. And when it came to explaining ASD, is that sometimes like one of the traits is the struggle to mentalize certain things, such as social situations. So, and also like something interesting that I found is that ASD is a neurodevelopmental. Is it a neurodevelopmental? I'm not sure if it's a disorder. I'm trying to be correct here. But it's that the traits can be with you when you're born or start coming through when you're older as well. As is with gender identity too. You're not born, and then sometimes there are 3-year-olds that are showing gender identity issues from that age versus when you're a teen. Yeah. So I think, where was I going with this? Yeah, it's that connection that maybe it's the mentalization that could be one of the reasons that as you grow into your ASD traits, sort of, gender identity issues also become a thing. Correct?
Yeah, so what I've seen so far as well, like there's a couple of kind of suggested reasons or possibilities around this. That's one of them for sure, that it's that idea of, people who are ASD, they are already questioning society and questioning things. So there's, like you say, that kind of mentalization and starting to realise, but there's a questioning of, because the world isn't obvious for them. It's built in a different way for people who are, it's a neurotypical world that we live in, is what I'm trying to say. So people with ASD, for example, have to figure out how to fit into this world, where the world isn't trying to necessarily figure out how to allow them in. They have to figure that out for themselves. So there's lots of questioning of social rules and constructs because they don't make obvious sense to people who are ASD, for example, or for at least for some. And then as a result of that, there's going to be questioning of a lot of different things. Why is it that only the boys get to play football and the girls have to do something else? Or why is it that girls get to wear silk, for example, and that's not necessarily something boys would wear? So now I know society is starting to change on that as well, but that kind of questioning can come up. Whereas for somebody who's neurotypical, there might be more of just an acceptance that that's the way it is. Again, as I say, we're changing, but from a historic point of view, when we're neurotypical, we might just accept society as it is because that's the way it is and that's fine. But there can be that questioning. And that can then lead the person to question around gender, as you're saying, that mentalization of gender as well, like what it means to be male or female, or, do I fit with them? One theory around it that I'm not a huge fan of, but it kind of comes from this idea of that literal thinking that might be associated with people who are on the autism spectrum. So, okay, very literal, boys like football, I don't like football, ergo I'm not a boy. That's very literal in its sense. I don't like that theory though, personally.
Doesn't welcome nuance.
Yeah, I feel that is almost using an autistic trait of literal thinking against the person.
Correct.
Rather than accepting that they may have actually put a bit more thought into it than that, if they're deciding that they're trans, etc. So that's one out there, but as I say, not a huge fan of it. I would sit more so with the previous one, that people who are maybe autistic are giving that questioning to society in general, and they're just more willing to be open to exploring what actually makes sense for me. And I was listening to a talk from an autistic person recently who happened to be talking about gender as well. And they were saying, you know, their words, so quoting from them, they were saying, well, if society already perceives me as a bit of a weirdo for one part of my identity, why not just embrace all of my identity? Because I'm already going to be considered a bit of a weirdo anyway. Again, their words, not mine. But I thought that was an interesting take on it, that there's a freedom perhaps in that, in being able to embrace all of themselves. Because whether they pick or choose the elements that society will like or not, they're kind of going to be seen as different either way.
Let's talk about the double empathy problem, if you don't mind, where this comes into it. Could you explain it?
Yeah, so double empathy problem. So that is, it's around a couple of years now. So to break it down, so if we think about it from a historic point of view at least, it would have potentially been perceived that when somebody who's neurotypical was trying to communicate with somebody with autism spectrum disorder, there would have been perceived a communication challenge on behalf of the person with ASD. They would have had a communication issue in trying to communicate with the neurotypical person.
Okay.
But double empathy problems highlights, well, actually we have two individuals who have two different ways of communicating, trying to communicate with each other. So why do we only perceive one of them having the challenge, when in reality both people have just very different ways of communicating, and they're both trying to communicate with somebody with a different way of interpreting information? So it's actually a two-way street. Hence double. There's two people. There's a double problem rather than an individual. The empathy piece of the word then comes into it from that perception of, a bit like what I said a moment ago, that we live in a neurotypical world. So the world is kind of designed with that assumption that people are neurotypical. So me as far as I know, I'm neurotypical. I haven't been tested, so I'm not sure if I'm on the spectrum or where I may be. But if I, as a neurotypical person, I can read your body language. I can assume certain things about you. I can make those kind of judgments or assumptions about you based on your body language, about your tone of voice, about those kinds of things. So the empathy that I have, because I'm able to understand you, means I'm able to read where you're at. And this is where we're coming from. If we have somebody who's maybe on the spectrum, these are things that are often talked about, that those kind of body language or social cues and things like that may not be so obvious to the person who's on the spectrum. So again, that's where the empathy piece comes in. I, as a neurotypical person, are looking and I'm able to read that, whereas the person on the spectrum may not be able to. So again, it's about the communication and being able to understand where the other person is at. So double empathy problem. So
interesting.
Two people, two different ways of communicating. Empathy, one can make certain assumptions that the other can't, or may not be so obvious to, and hence we have a problem as a result of the communication.
That's interesting, because I think the way it is often, these things are often spoken about, is that there is the neurotypical cisgender path, and this is like zero nearly, like that's the norm.
Yeah.
And then everything else is just different.
Yeah.
And the way it is spoken about is nearly of like, we need to not even treat people differently, sort of, but there is this conflict nearly where it's like, you want someone to be able to walk on your path, the same path as you, but these people aren't meant to walk the same path as you. They're meant to walk their path.
Yes.
And what this is emphasizing is that someone walking their own fucking path is perfectly fine. Correct? And it's like about like letting go of these, not even stereotypes, but letting go of these ropes that are trying to like draw people in to keep walking in the same direction.
Yeah, and I quite like your analogy of being on individual paths. And I think you're right that, like, you know, the way we typically would go is we're trying to pull one person from one path to ours,
Yeah, like
or
they
vice
need to
versa.
adapt to
Exactly.
our way, in inverted commas, for people that are listening, our way of living.
Yeah. But what I would say, if I can add to your analogy, if we can build this a little bit
Let's
together.
keep building, you know.
I would perceive it then in perhaps where we should be coming from is a way of building a bridge between the paths so that we can pass information or meet halfway or whatever that may be. So rather than pulling somebody off their path to match mine, it's like, well, how do I reach them on theirs without fully leaving my own, because it's my path to walk as well, etc.
Are there any bridges being built, if we were to stick on this metaphor?
Good point. I don't know of official bridges as such. Something I would do within the therapy session with clients to try and build some of that is like shared kind of communication. So shared language, shared things. So I would often ask people, okay, so if we're going to do something, like I might ask some people on a scale of 1 to 10, how are we feeling, or something to that effect to keep it simple. But I would also check in, how are you with scales? My assumption is that people are fine with scales because that's the way I work. I come from an IT background, so numbers, logic, all that makes sense to me. My brain works that way anyway. But some people might want to be more creative. They might want to be able to do it differently. So it's like, okay, I don't want to put a number on it. I want to put a color on it, or I want to put a size or a shape or whatever it may be. So we come up with that kind of shared understanding as to what blue represents versus green, what a triangle versus circle represents, or whatever it may be, so that we have that shared understanding and we kind of come up with a shared communication or shared language then. So to me, that would be an example of building that bridge. As I say, I'm not hugely aware of official ones per se, but I think it's important that we have that flexibility.
That's it. Cora, everything okay before we carry on?
Yeah, it's just sometimes it gets a little bit kind of cut off at the back of your head, but it's okay.
Oh, shall I scooch?
Yeah, maybe you scooch in a tiny bit, and if you can scooch just a tiny bit up that way.
Yep.
There you go.
That's perfect.
Okay, amazing. So something interesting that I also did while preparing for this chat is it was very commonly explained where it's like this connection is not highlighted as a way to say that any of these things should be solved. So it's not about, because I do think that when stuff like this is brought up or these connections are brought up, then it's quite an easy way for certain people to just like hate on it, you know, or just go like, oh, again, this is not what the research is saying, but it's like, you're not trans, you're autistic.
Yes.
And a lot of the research that I did notice, it was saying, it's like, hey, that is not the case. It's about these two being like living within the same body and both of them being extremely valuable and important to the person. And what's important here is that if someone that has ASD and is experiencing gender identity issues, we need to figure out a way and a process in which we can help them validate their gender identity. And someone that is suffering with gender identity issues, let's see if potentially they could have ASD.
Yeah, so I've seen the same in the research, and some of the guidelines that have been published around working with people who happen to have both trans or ASD. The guidelines for mental health professionals anyway is that if we're diagnosing for one, we should also try diagnose or check for the other. It's not to assume the other is going to be there, but because there's such a high overlap, well, while we're looking at one, why not look for the other at the same time?
It's to decrease the risk of mental distress.
Yes. But the issue with that not being done at the moment is a bit like what you're saying, but even within the medical world. So let's say somebody comes out as trans and they're on their journey of getting maybe gender affirming surgery or whatever it may be that they're looking for in relation to that. They're afraid to go looking for a diagnosis in relation to ASD, because if they do, for that very reason, it's like, well, you're not actually trans, or maybe you're confused, or maybe you're the autism diagnosis can and has been used as a barrier for some people to access trans affirming care.
Wow.
So there's this fear of, if I do go for this secondary diagnosis that I think I have, while it might open up doors and give me support, because a lot of the time we need a diagnosis, we need the label, whether we agree with labels or not. Sometimes we need the label to get the support that we want or we need. But if I get that second label, it's going to block me with this part of my identity. So there is a holding off, or I'm not going to actually go and seek that until later in life, or once I've gotten whatever support I need with the current situation I'm in.
Would that nearly be a little bit of a stereotype about ASD? That it's like, it is a, like, what is your take? Because a lot of people, there's this conflict of ASD is a disability. It is a disorder. And I've seen clinicians say that, look, people that have ASD, especially the further deep into the spectrum it goes, a lot of the time they're not able to take care of themselves or look after themselves, hence therefore. But then there's a lot of people that do have ASD that are like, I don't like that term.
I think you're right with the idea of disability coming into it, and then as well, even it comes down to terminology, like to say a person with autism or an autistic person, which do we put first? So even the terminology can be very, very important for some people, depending which way it's said, etc. But I think going back to what you're saying though as well, from the kind of the doctors and medical kind of world and that, yes, I think this is the issue with when we're talking about something that's on a spectrum. We have, the extremes we mentioned earlier on, as you kind of alluded to. We have people who are very much able to take care of themselves and think for themselves and make decisions for themselves, etc. And then we may have people who may have challenges with that. But at what point do medical professionals stop listening to one cohort of the same spectrum and decide for the client, for example, or the patient, versus when do they actually listen to the patient and accept they're able to make decisions for themselves? Where is that line when we're talking about a spectrum of something? I think that can be very difficult. And I think what happens then is the medical professionals try to err on the side of caution, so they're less likely to perhaps offer things, services or whatever decisions to be made on behalf for the client themselves. If we're talking about a spectrum.
Well, why?
I hope that makes sense. I'm not sure if it did. Why? Well, I think it's with any profession, it's self-preservation on the medical professional's behalf.
Gotcha.
I'm not saying it's right, but there's if I'm dealing with somebody with a diagnosis where some people with that diagnosis might have challenges in making decisions for themselves or whatever the case may be, well, then I'm going to err on the side of caution here to make sure that I don't let somebody make a decision that is regretted or they come back or whatever it may be at a later point. I don't like saying that because I'm also aware that there's a removal then of the individual's autonomy and removal of their ability to have some level of control and decisiveness over their own life as to what may or may not need to be happening or support or whatever it may be. But I can, from a logical perspective, I can see why medical professionals might do that. Not saying I agree with it, but I can see why it might happen.
Yeah. I can only imagine how difficult it is to, even right now, just talking about it, because it is such a sensitive yet important topic.
Yeah.
It's like you have to be careful. In fairness, you should always be careful with the way you say things, you know? But then it's also like you don't want your things to be misconstrued.
Yes.
And then there is also an element with technology and its advancement on social media and the rise of youngsters self-diagnosing, that you have to be very careful.
Yeah, and I think this I would say spans both sides of it. So both trans and ASD. I think around that. You're right. There's a lot of my social media, because I don't know if it's because this is something I'm looking at, because it's what I'm researching. So I'm open to looking at both sides of it or whatever. But my own social media has started to show me a lot about neurodivergency, and if you have these traits, you might be autistic, or you might have ADHD, or all these kind of things. That's all that's popping up on my own social media. I'm an adult. Would like to think I'm fairly secure in who I am as a person, etc. So I've done some work, I've been to therapy, all those bits, do you know what I mean? So I'm in a relatively secure position, I feel, so that when I see them, it doesn't automatically make me think, oh, maybe I am or maybe I'm not. But I can see how that can have an influence for younger people. And I think that's where there can be this idea of, self-diagnosis versus official diagnosis. And that's something I would typically ask clients if they come in and they say, well, I am depressed, I'm anxious all the time or whatever. It's like, okay, is that something you've come to a conclusion yourself, or is it that diagnosed? And it's not to say I'm going to treat them much differently, but it's just to know, well, where are we starting from with some of this is really important to know. So I think there is an importance and a relevance needs to be put on how or where the diagnosis comes from, but at the same time, where do we draw the line without dismissing somebody who's coming to us saying that this is who they are as well? And I'm not just saying you're suggesting that by any means, but or anything like that. But again, it goes back to that, where is the line? Like, yes, we need to be aware of both sides of it, but it's a grey area as to where that line lands.
Exactly. And would you have much insight into the space in Ireland? Like, let's stick with Ireland right now. It's like, are doctors listening to this?
That I'm not entirely sure. So what I would have looked at so far would be more so around mental health kind of services and that, as opposed to GPs and doctors.
Perfect.
But from that side of it, what I'm seeing is that people are really, really struggling to get access to mental health services or psychotherapists, etc., that are even aware of one element, so either trans or ASD, and finding somebody that has knowledge of both is, I quote from research from participants, almost impossible is what they're saying. And what that leads to then is we have a cohort of people who are looking for help, looking for support, and they're left frustrated, angered by having to take what's left, essentially, within the medical world.
Settling for crumbs.
Settling for crumbs, exactly. And we also, these are the same people who may have been mistreated or judged or discriminated against by other professionals, by the medical world in the past. Like, if we think of transgender, etc., like that would have been seen as a mental disorder, or do you know what I mean, things like that. Similar with ASD, etc. So the medical and mental health world may not have been the nicest towards these cohort of people in the past, so there could be a level of distrust to begin with for the individual to come in and going to be just seen as an issue, a problem, or a or like you were saying earlier on, something that needs to be fixed or cured, or, that idea that when that's not the reality. This is more, the research is just showing this is a thing that exists. It's not about solving it. But we may have people coming who have had those experiences. I've had clients come to me who are trans, and they're checking in with me, before they come into the first session. They're like, can I just check, like, do you have any knowledge of transgenders? And I'm like, yeah, I do, etc. I explain or whatever. And they're like, oh, good, because I've been misgendered by therapists. I've had transphobic things said to me by therapists. So, this still exists and it still happens. I don't know whether it's naivety or my positive outlook on the world, I would like to think that those things happened in error by other therapists, but there may be therapists out there that genuinely believe that what they're saying is accurate or whatever it may be when they're saying transphobic things towards clients.
The lack of education there it's sad nearly, because it's there. And I think it hurts probably for people even more because it's commonly communicated to us that this is the community that we should trust. Check with your GP. Yeah. Talk to a therapist. It's always like there's these folk that are going to listen to you. And it's often very difficult then to throw yourself into a process where you start off trusting and you get tainted so deeply and far along the way that then you just go like, fuck it.
Yeah. Absolutely. And I can see that, like, it goes back to what I was saying earlier on about, I think it's so important as a therapist to build that collaboration and to build that trust with a client, because you know, just for somebody to walk through the door into a therapy service or wherever they may be going for support, that in itself can be a monumental task.
Yeah.
And then for them to go in and have such a negative experience, why would they ever go back to any other mental health professional again, you know, if that's the experience they had? So I think it's so important that we take that on board. And you're right, it's that process of go talk to your GP, go talk to your therapist, whoever it may be. That's what's put out there, and it's almost putting those professionals on a pedestal. And don't get me wrong, you know, there's a lot of education and a lot of, you know, study, etc., needed to do those things. And I would like to think a lot of the professionals are professional and are good and safe to go to, but at the same time, where is the space for the client or the patient to turn around to the professional and say, actually, I don't agree with what you're saying, or that isn't going to work for me, and to be heard in that and to be respected, that they might actually have some relative input to give on their life. Like I was saying earlier on, I perceive clients as the expert in their life.
Yeah. And that personal bias as well, and like the literature, you know, and people... Like, for instance, I'm sure you might have a little bit to talk about it, but like the way this gender dysphoria is discussed, like people are kind of just saying that people are just like waking up and deciding to identify as the opposite gender, when in reality dysphoria is very difficult to endure and go through.
Yeah. Oh, absolutely. And I think I think there is that, like, it's a bit like that pendulum swing you were talking about earlier on as well. I think there's that idea of that, like, okay, like, you know, back in my day, there was no such this, and like you wouldn't have heard of. And it's like, yeah, but would it have been safe back in your day? It would be how I'd follow that up with, like, just because it didn't happen didn't mean it didn't exist, you know, is the way I would look at it. We have terminology now, but we also have a society and a space where it might be somewhat safer, I won't say safe, but somewhat safer for people to actually be themselves and to say, well, this is who I am. You know, you see it within the LGBTQIA plus community as well, like where we have younger people at the moment who are able to come out and, you know, and live their life, and that's fantastic. But we also have to realise there's a lot of older people who would have lived their lives in the shadows or gone into heterosexual relationships because that's what was expected of them at the time. And I've heard of somebody, anecdotally, they're talking about a granddad coming out at 80. He was married to a woman, etc. So, you know, it's because society has moved that people are able to come out and be themselves. So that might be part of why we're suddenly seeing this explosion, as some people would like to say, of people identifying as trans or different sexualities and genders, etc. For me, that's what I think plays a big role in it, that it's actually possible for people to do it now, whereas it wasn't necessarily as possible or safe to do so.
Obviously, I know that you have to be very private about the patients that come through and like your research, but what is a common issue or hurdle or block that a lot of your patients like seem to experience that you wish others knew or were more sensitive about?
I think it's the being othered, I think is the main thing. So being seen as different or treated differently. So I've had, you know, like trans clients come to me and talk to me about, like, quite literally just people pointing and laughing or coming up to them and saying some awful things straight to their face, and all they're trying to do is get the milk and bread in the shop. Like, they're just trying to go about their business. They're not at some rally, they're not at some protest. Not that we shouldn't do that, but at the same time, they're not putting themselves out there.
They're just existing.
They're going about their daily life, and this is their experience. Similarly, with people who have autism, for example, it's been seen as I suppose really going back to what we were saying earlier on, like being perceived as somebody who might have more challenges than they have, or they're not being trusted or being talked down to, or that kind of side of things as well. They're kind of common things that I would have seen with clients that have come to me anyway. The interesting thing around that, though, is that there's the overlap within the research would show that for mental health, for both categories, so for the trans population and ASD population, depression, anxiety and low mood are the top 3 for both. So again, there's an overlap of experiences within that, and things that kind of, it was only when I started to look into this a little bit more, I started to realise actually the experience of those populations, if we separate people who are trans and then people who are ASD, there's actually very similar experiences for both cohorts of people. So for example, like we have social camouflaging and autistic burnout within the ASD population. So that's where people are trying to mask who they are or fit in or hold back certain parts of their behaviour or their trait to try and feel like they meet the expectation of society. But then we have the same within the trans population of trying to pass within society, pass as the gender of who they are and being seen in a certain way, or maybe they have to hold back part of who they are for safety reasons because it's not safe to be their authentic self in that particular environment, or maybe even in a medical professional holding back their trans biology because they're in a medical situation and there's that kind of heteronormative, cisnormative kind of assumption coming into play. So it's assumed if you see somebody in front of you, you can assume their gender. Not necessarily, and especially difficult when we're in, if a trans person's in the GPs, for example, trying to get certain support or help or whatever it may be for medical reasons. So there's a lot of overlap between the two there as well in their experiences.
I'm not saying how can people help, but how can this experience on Earth be made easier for them?
Big question. And this is where I think need to be transparent. Like I think I named it earlier on. So I perceive myself as neurotypical and I'm cisgender. So I can't speak from personal experience on that as to what that might be. So I'm aware of that and I just want to name that. But at the same time, what people have shared with me, at least, and what would be helpful for them is to, just to be left alone. And you know, if you have a nasty comment, like going back to, it's such a trivial thing, going back to, if you've nothing nice to say, don't say it at all kind of thing. Why is there a need to go up and point and laugh or to just be nasty? But I think as a society, I think if we're able to, going back to that bridging that we developed, we'll co-author that, right?
if it ends up on your thesis.
Fair enough. I'll give you credit. Don't worry.
Please.
You'll be in there.
I'll be cited.
Yeah, absolutely. But I think going back to that, it's just having an openness that there are different people out there that perceive the world differently or interact with the world differently, and letting go of the assumptions as much as we can. And that can be hard because as humans, we're built to assume and have bias and suss things out and all of that. But I think just being open is really where I would come from, and just to allow for differences to exist. You don't have to agree, just to allow for it to be there. It's
just like such a heavy chat. But also, why is it heavy?
I think it's going back to some of what you said before. It's an important topic. There are important things to talk about, but I think there's fear related to talking about it. There's fear in saying something that might be construed a different way or received in a different light as to what may have been intended, etc. And I've seen that a lot. So I spoke earlier on about clients coming to me saying they've had challenging experiences with therapists in the past, but I've also had therapists come to me and say, I wouldn't take somebody on for fear of getting it wrong. I don't want to do any more harm. So there's a fear of even engaging with a client group because of, will I have the wrong language? Will I say the wrong pronoun? Will I, say or do something that's unhelpful? So there's a fear within the mental health services, at least within the psychotherapy world, at least from the people that spoke to me, not to say that's everybody, but just the few that have. But I think that permeates society a little bit more though as well. There's a fear of getting it wrong, a fear of, do I know enough to actually articulate my point here or say what I want to say? And I think this is why it's really important for something like this, where we are talking about it, we are putting it out there. Hopefully it's received in the light it's intended. But at the same time, it's important it's talked about, because otherwise it just doesn't get talked about. And I think that's why for me, that's why there's a heaviness to it.
I agree. Like, I feel like this entire conversation, like I held my breath. Does that make sense?
Yeah.
Because it's so important.
Yeah.
It's so fucking important. This is people who are dealing with such mental distress. And one fucking conversation could mean that someone in their life can maybe direct them steer them in the right direction, or plant a seed that will have them ask the question and try and get a proper diagnosis. Or again, vice versa, because it's not all about it, like it's talking about ASD and gender identity issues and the two coming together.
Yeah.
It's interesting too, because even like on my like self-reflection when we were like discussing this and I was preparing for this chat, it's like I had to do a lot of thinking and going, okay, what's the connection there? Is there a solution? You know, it's like not even that there's something wrong there, but can this be solved? Because I do think that a lot of neurotypical cisgender people then go, we don't want you to suffer.
And I think that's, while there might be good intent behind that,
Bingo.
and I'll name that, but is that back to what you were saying about the different paths?
Exactly.
Trying to pull somebody to my path because my path's lovely. Come on and join me over here.
Yeah. And it's that recognition of privilege, you know, and that reflection. And this is like me kind of word vomiting and realizing my own, not problem, but my own misconception of like the way I see the world, and going like, yeah, okay, like you're the different one, where in reality it's like, fuck no. You know, like, again, I'm talking about me, by the way, guys.
Sure.
Like, don't, I promise you, I mean well. But yeah, it's an interesting topic that kind of just accepts the fact that, like, listen, that connection is there. Let's recognize it. Let's talk about it. And let's give people that are struggling, because I really try to get rid of them, just so that I'm not othering them as well.
Sure.
Let's give these people that are suffering, like, let's make their life slightly easier.
I think that's really important. And I like what you said there as well about kind of recognizing the privilege that we may have. And that's why it was important for me earlier on to state that, as far as I'm aware, I'm neurotypical and I'm cisgender. Okay, I'm part of the LGBT plus community, but those two things, cisgender and neurotypical, I have to name that. That's where I'm starting from. That's where I'm coming from. Yeah. That's the path I'm on.
Do you feel, or do you get a little bit of pushback sometimes on talking about this while also not being any of the two?
I haven't received it, but I think going back to the heaviness, as we were talking about earlier on, I'm aware that I could be perceived as, you know, who's this guy coming in? What right does he have to speak on this, etc.? And that may be very valid. You know, all I'm doing is I'm giving my interpretation of the research I've read and the information that's been given to me by some of my clients. Again, obviously confidential, but more general kind of stuff that's come to me from my clients and just from speaking to people. So I'm just trying to share what I've accumulated so far. I'm not trying to say I am the expert in all of this, or far from it.
True, yeah.
But it's more a case of, well, I've been invited to come here and talk on a podcast, a bit like what you're saying about sharing the topic. So from your perspective, I've been invited to come here on a podcast to talk about something. It's like, well, to me, this is an important topic. So why not use whatever platform I have to talk about it and raise awareness and bring some attention to it, using whatever privilege I may have. So I'm here because I'm doing a doctoral study, but that in itself is a privilege to be able to do that doctoral study. So I'm using that to shed some light, or to offer something to a community that may not have the same level of awareness or spotlight on them.
Yeah. Because I think at the end of the day, it is the element of community.
Yeah.
And probably but it is my assumption here that the goal or the happy place in which like we could all live is when everyone has a seat at the table and recognizes the person's like individual experience and also like empathizes, but like we can just sit down. With the amount of conversations I've had and with the amount of conversations that I've published, that's the one thing. It's like the goal is when the conversation happens outside of the exclusivity. You know, that's where like the good shit and like the decision making and all that kind of stuff, where the word is not just paused on, but if we keep waiting for the right person to talk about it, no, let's not talk about it right now. You know, that's I think that does more harm than good.
And I think that shuts down the conversation as well, as you're kind of rightly pointing out there. But at the same time, it adds to the heaviness that we spoke about earlier on. It's like, well, you're only allowed to talk about it if you fit a certain criteria for a certain cohort or whatever it may be. Whereas I think, like you're saying, it's, well, if we have enough people talking about it, shit might get done.
And hopefully it encourages people to also ask these questions, you know, and not fear curiosity. I think right now a lot of people do mean well, but I think it's like a loud minority from both ends or extremes, if we were to call it, are super confident in speaking their minds. And then there's a very curious majority that is sensitive and listening and wants to know more, means well, but is scared of the two ends of the spectrum, me included. I've been saying this like outside for off of the podcast for a while, but I've been getting quite a lot of pushback for being curious and like and getting myself and the guest and whatever we're talking about getting heavily criticized for saying one thing wrong from a 30-second clip from a 2-hour podcast. You know, it's like nuance is not welcome on social media. And that's probably like affecting me as well, because then I'm like scared to be curious. Because it's a very difficult... I'm not saying that this is fucking brave. I'm not fucking brave.
No.
But coward. But what I'm saying is that like it is very difficult then to just like have these conversations because of all these outside voices.
And I think that goes back to what I was saying about therapists that I spoke to.
Yeah, because then they avoid it. They're like, I don't want to help this person. I want to help, but... I'm afraid to.
Yeah. And I think that that's where that kind of danger is within that, when there is a small minority, as you highlighted, but there is that strong criticism then of somebody who is curious, who wants to learn, who wants to know more. They're doing the best with the knowledge they have so far, but they're open to getting more. And there's a step or a word wrong or whatever it may be, and it's called out in such a strong way. It then shuts down the conversation. It stops the person being curious. It stops therapists feeling comfortable and confident to be able to at least open their door to certain people when that's really needed.
Wow. I genuinely didn't think that this was going to be the takeaway. It's the element of shutting down conversations or help being given or provided, because of all of this. It's sad, nearly.
It is. I mean, I'm all for correcting and informing and educating.
Facts.
All for it, and I welcome it myself.
As in, we're all evolving. You don't know everything.
Exactly.
I'm further down than
Don't know about that. I'm all for that, but at the same time, I think, I think it just comes down to how it's done. I mean, if you want the person to receive the information, give it to them in a way that they're able to receive it. If you come with an attack or a strong emotive place, and it's a reactive response that we're having, it's understandable, but is that helping what the message you're trying to deliver? Sometimes I'm not sure it is.
Alan, how was your Pride Month?
My Pride Month was good. So I'm one of those reclusive gays. So I might get my gay card revoked. I have only been to Pride once in my life.
Hey, I didn't go to any
Do you not go?
No.
I think that's really important though to acknowledge as well.
It's so weird, right? Because it's kind of like I saw this, strangely enough, I saw a TikTok, but like she was a youngster, in fairness. There was a TikTok that went like, I'm the type of lesbian that likes girls, not the type that waves rainbow flags. I'm not sure if it makes sense. And someone corrected them and said, you know that the people that the rainbow flag type of gays are the reasons you have rights. You know, like go fix your internalized homophobia. So there was that whole spiel.
Yeah.
And I was like, shit, am I a bad one?
Yeah.
Like, did I just fuck up? You know what I mean?
Yeah.
But it's true. I'm not. I always get the question like, what do you think about pride? And I go like, I'm not.
So I will clarify. So
clarify.
Because I think that's really what that person was saying. I think is really important as
So
well.
true. Yeah.
And absolutely. Oh, I am so grateful for the rights that I have, and for the people that came before me, and for those that put themselves in very clear danger to try and get it. So very appreciative of that. At the same time, though, I as person, I'm not a drinker. I don't go out partying. That's just who I am, and there's no judgment in that. That's just not who I am. And you know, I've gone out a bit, I've done a bit, you know, the whole lot over through my life and that, but it's just not me. It's not my thing. Love seeing Pride. I think it's fantastic, and you know, I've attended and I enjoyed it when I attended it and that as well. But I think it's important to be able to allow people be themselves. So whether that's like the rainbow flying flags and they have their face painted, fantastic. I love seeing it. It's just not me.
Yeah.
And you know, I'm able to involve myself as much as I can, but allowing that to be okay as well, I think is really important.
It's so important. And I feel like it is kind of true where there isn't a divide nearly, but it's like you don't need to be like pride is kind of so spoken about right now with like via the parades and via the rainbow flags and via the block parties and all that, and it's like yeah, fair, but sometimes it's kind of like the concept of a protest and the cause is being lost in the party, being lost in the sesh, if we were to keep it branded nearly, you know. And it's like painting, like changing your logo over to the rainbow flag and then bringing it back again is not the key here. It's like, are you able to walk holding your partner's hand in July? Or sometimes even in June, you know, like even during Pride Month, I can see a fucking flag up there, but I'm still like, don't touch me.
Yeah.
You know? So I feel like that's where pride is lost.
And I'm very much on the same page as you. So me and my husband, for example, like we don't hold hands. That's not what we do.
Is that internalized homophobia though, or is it fear?
I mean, it could very well be, but my thought process is safety. I just have a very high safety need for myself personally. And,
so true.
And that's what drives it for me. If that's coming from internalized homophobia, potentially. Well, I wouldn't say so be it, but potentially. But at the same time, it's like, well, I don't feel comfortable doing that. And is it okay for me to not do something I'm not comfortable with?
So true.
We're the exact same as well. Sorry, I have to chime in here. But like, I'm the same. Like, it's a safety thing. Like, as much as I'd like to, it's not worth how the feeling I get then, because I can't enjoy it, because all I'm thinking about is, oh, is that like a group of guys coming around the corner? Do you know what I mean?
Yeah. It's the confrontation and constantly having to explain yourself.
Yes.
You know?
And I've had negative experiences by not even doing public displays of affection, just walking on a street. I've been singled out and targeted because of what my sexuality was perceived. I don't know how they figured it out, but they did. Because I wasn't talking, I was just walking down the street. I wasn't wearing any rainbow flags or anything. So there was nothing that I can perceive as outwardly that was overly obvious. Now I'm not under any illusions that people can figure out when they meet me and they interact with me, etc. I'm not exactly your stereotypical butch straight guy kind of thing either. But because of those experiences, it has caused me to be overly cautious, hypersensitive, and as Panty had said before, checking myself, checking myself a lot of the time. And that's not even being in a relationship or in public or anything like that. So
that's just being gay.
Yeah.
You know? It's an interesting one. I'd love to see. I'm very curious to see where we're gonna be in 20 years' time.
Yeah.
You know, it's very exciting, but it's also like I'm just curious. I'm curious. Like now I'm starting to see like the women or gay people, queer people start to have families that are like 10 years ahead of me. And it's interesting because I remember one time I asked them like, would you know how that person started the family, you know, in Dublin? And it's like, honestly, didn't ask because we want to keep it private. Because like I didn't want to ask them. And it's like completely fair, you know?
Yeah.
But it's like, well, how are they doing it? You know, like there's certain like things as well that are kept private, not gate kept private for obvious reasons.
Yeah.
But it's like all this like cool stuff is happening without knowing. Does that make sense? I don't know, like for you, because obviously I'm assuming you would have like a very different circle of friends that might like have entered that stage of life.
Yeah, so I have a lot of straight friends who would have had children and that. Checking to make sure I don't misspeak, but I don't believe I've any gay or lesbian friends or members of the community who would be friends with who have children of their own.
Started families, yeah. It's still fairly new.
It seems quite new. And look, I know we have laws around surrogacy and that, you know, under review and coming in, et cetera, et cetera. So you're right, like who knows what Irish society might look like in a couple of years. One interesting thing, I think it's interesting, hopefully you do as well. One thing around that though is research has shown that our views about our own sexuality can be tied to the how do I say this properly? Tied to societal views as to when we came out. So what I mean by that is I came out in the late 90s, would have been when I would have come out.
How old were you?
I was 16, I think, at the time.
Early on?
Early-ish, yeah. What the research suggests is, and I'm not saying this is going to happen for everyone, but just an interesting thing. If we take me as the example in that, then coming out in the 90s, the research is saying that I will carry... my view of my sexuality will be the same as what 90s Ireland viewed it as, and I will carry that throughout. So even though Ireland has moved on and we've had civil partnership and marriage, etc., and all those things, and I'm married, so I've gone through some of those things myself. The research would suggest that I would still hold and view my sexuality in society the way 90s Ireland did, even though society has moved on. So I just thought that interesting that we can kind of get stuck with our views a little bit, depending on when we come out, and we take them on.
It's kind of like the back in my day, you know, type of situation. But it also does apply to us because that is, I can relate to that, you know, where like, of course you want to adapt, but like we do tend to point the finger at like the generation above us, like you need to like keep up with the times.
Sure.
But in reality, it's also like, it's with us too. It's our past, which was once a present. And that's interesting. When did I come out? I came out when I was 18. So that would be 2015. So nearly 10 years now. Yeah. So I think that was an interesting stage when rights were starting to come through. I know that gay marriage was legalized or something like that in America. Like that's when it happened. Because I remember very clearly going like, like gay marriage is legalized in America or something. And it's like, is that a good thing? And I remember that being like, whoa. Yeah. Like internally crying, I'm gay. So I remember that. But it's strange because it is kind of true. Like things have moved. Yeah. Like they have progressed a lot. But... it's kind of, I do think that queer people in their mid-20s are kind of looking at your generation going, what's it like for you guys over there?
Well, like one thing, I was only talking to my mom recently about this actually, but like when I was a teenager, I never, and even into my early 20s, I never even had this image in my head of what my life would be like in the sense of having a partner and being married and having kids or whatever, because that wasn't even possible. Like it wasn't legally possible to even have civil partnership at the time, never mind marriage. So having a other half wasn't in my picture because it didn't exist. It wasn't possible.
Yeah.
Having kids wasn't in my future. It's not like, I know you might argue, well, you know, some men don't even think about that until they're a certain age and yada yada. And yeah, okay, that's a thing. But there's a difference between not wanting it and not even thinking about it, is what I'm trying to say, because it just was not an option. It wasn't possible. It wasn't even something to consider.
In fact, like, it is quite a thing when, like, now this is my own observation,
Okay.
but I do see a lot of gay men in their 30s, 40s, 50s. They're still, like, fully going at it. Like, they haven't settled down. It's just like, it's the parties, it's the drinking, it's the sex, it's everything. And it's that... It's not even just like a judgment there, but it's also like they didn't see, like they don't not even have a path to follow, because it's just about like they didn't reinvent anything. They're just like doing what they saw.
Yeah. And look, for some that may be what they're happy with.
What
and
they're
that's-
happy with, and
that's
fair
fine.
play, you know,
Yeah,
like
go
God
for
bless,
it.
you know.
But yeah, it could be possibly for others that it's like, well, my only option was to marry a woman, so that wasn't what I wanted. So
Yeah, and that's a little win in itself if they did come out before that. But again, nothing wrong with having to do what you had to do in that time.
Yeah.
So interesting. The world is a weird place.
Absolutely. We all need therapy.
We do. We do. Oh, man. Again, thank you so much.
Thank you.
Can people find you anywhere?
Yes, so Dignam Counselling, so dignamcounselling.com, or I'm on Instagram now as well. So it's relatively new, so you won't find an awful lot there yet, but I'm hoping to add to it.
Bring it up. Bring
Yeah.
it up. Amazing. Thank you so much for joining me.
Thank you.
Thank you, everyone, for listening and watching. Bye-bye. Take care of yourself. Do not self-diagnose.